Dear Papa, on September the 29th, 1918, from Blacksburg, Virginia.
The faded ink of penmanship preserved on paper.
I received your very appreciative letter last Monday.
Provide David Wayland the only connection.
All of the soldiers left here yesterday.
To his uncle Charles.
He and my father were very close to each other.
Charles was early in his freshman year at Virginia Polytechnic Institute when he wrote this letter home to Crozet.
We are supposed to begin to study our lessons or get started in our courses here this week. Here was a very healthy young 18-year-old, I guess 18, 19-year-old student at Tech who was doing fine, didn't have a care in the world.
A month later, Charles was dead.
I never heard them talk about it at all. Had to be very painful to talk about it.
David discovered what happened to his uncle in a series of letters dispatched from Blacksburg.
Here's that letter.
They describe 10 anxiety-filled days.
The doctor told me that his lungs were clearing today.
Of a mother caring for her ailing son in the campus infirmary.
Charles makes my heart ache because I know he has been so lonesome, and he doesn't want me to leave him.
A front-page notice in the November 1st Daily Progress reported the news home. Charles A. Wayland is flu victim. It describes him as a young man of much promise.
It's really sad. It came so fast on him, and I guess on others too, it seems like.
Wayland's is one of dozens of death notices that became a daily part of the newspaper's publication as the influenza pandemic spread through central Virginia in the fall of 1918. 16-year-old schoolgirl victim of Spanish influenza announced the headline October 3rd with the death of Rebecca Edwards. John Hamilton Rhodes was a hotel clerk whose death was hastened by an attack of Spanish influenza. The newspaper announced the death of Judson McManaway October 11th, remembering him as a splendid young man whose brother was quite sick with the same insidious malady.
Within a week to 10 days, the death certificates just pick up and pick up and pick up, and these were children and teenagers and adults and others, all dying.
University of Virginia School of Medicine researcher Adine Kelly spent years studying the impacts of the 1918 pandemic on Charlottesville and Albemarle County.
It was a major crisis everywhere it struck.
Days after the first reported death, Charlottesville's mayor ordered schools, churches, and theaters shut down. The Grip closed a grocery store when its owner showed symptoms. Within a week, the paper published a plea from the district nurse. Mrs. Harris is overrun and needs many volunteer workers to care for whole families stricken with the virus in many parts of the city.
The federal government had no resources to help anybody, and the state had no resources either except to give advice. Therefore, the full weight of the pandemic fell on local officials and the local community.
The 200-bed University of Virginia hospital stopped taking in patients. Its now tattered and taped-together register offers a record of patients admitted for influenza pneumonia. Some recovered, diagnosed as well.
Between the number of doctors that were assigned to the university hospital and the number of nurses there, it made a great deal of difference in local health.
The hospital register also provides a partial tally of the local death toll.
Usually the most severe cases went to hospitals. Almost everyone was taken care of at home. That was the norm.
Kelly estimates the flu killed at least 400 people in Charlottesville and Albemarle County, yet the pandemic never blazed across the newspaper banner. That's because the nation was at war. Central Virginia families were sending their sons to the front lines of World War I. Names of men wounded or dead in battle stole headlines from the fight against the deadly flu at home.
The influenza pandemic faded from cultural memory before very many years.
But I don't think we really learned the lessons.
Retired pediatrician Dr. Michael Dickens is working to connect the past century's pandemic to the one we're fighting with masks and social distancing today.
And I think the war really brought everybody together, as opposed to now where, it's clear that we're not all together in terms of how we're all reacting.
He's uncovering recommendations public health officials published in the paper at the time.
They didn't have a Dr. Fauci standing up there.
And searching archives of the Albemarle Charlottesville Historical Society.
The flow of information was slow in getting out, and there wasn't this constant churning of facts and rumors and counter-rumors like we see now.
Dr. Dickens is able to draw comparisons between the flu and COVID pandemics. In both, volunteers came together to make masks. Lockdowns and quarantines slowed the spread.
Where there's no real treatment for any of these highly infectious diseases, they were very used to the idea of being quarantined.
Dickens says the flu disproportionately affected Charlottesville's black population, just like COVID-19.
When they got sick, the deck was already stacked against them because of poverty and malnutrition.
Dr. Dickens worries medical advancements, treatments, and vaccines make it easy for people to forget pandemics of the past. He believes progress comes by following the science.
They're following the basic biology of the virus, which doesn't change from generation and century to century. It's still the virus versus us and our immune system.
I will stay with Charles as long as I am needed.
Even though a century separates these words from David Wayland,
it's all coming back in lots of ways.
The 84-year-old can relate to his family's loss now that he's living through a pandemic like the one that claimed the uncle he never knew.
No family is immune from it then or today.
We've got memories here that could never be replaced.
Memories guided Paul Harris back to the University of Virginia a decade after graduating and walking the lawn.
To come back and be for the students here what my faculty and mentors were for me as a student.
The assistant professor of school counseling at the Curry School of Education started on the tenure track in 2014.
For me, that was always the goal in academia, was to get tenure.
His research focuses on college and career readiness for black males and black male athletes.
It's about researching, creating studies and collaborating with others to collect data related to that interest in particular, and then publishing about it, presenting about it at national conferences.
Harris thought he was doing everything right over 5 years to receive tenure at his alma mater and says he got great reviews until the Curry School's dean delivered the decision to deny tenure.
It was shocking. I was blindsided. It was it's hard.
Harris says an all-white review committee reached the conclusion.
Race has always been a factor in my lived experience, and so it's not even for me a question of if it's a factor, it's how.
A letter explaining the decision questions the quality and limited reach of the journals publishing Harris's research. It describes the Journal of African American Males in Education as appearing to be self-published. Harris claims the committee also deeply undercounted citations of his work.
Patently false claims, very misleading information, what I thought were egregious errors as it related to evaluating my case in context of my field and the impact that I've had within that field.
The university says it cannot release specific information about any particular tenure case because it's a personnel matter. The university also rejected our request to release specific demographics by race of faculty members who apply for, are granted, or denied tenure, saying that information could identify a faculty member.
UVA's diversity dashboard shows just 3.7% of faculty are African American. That hasn't really changed in the past decade. It's below the national average of 6%.
This is a system-wide problem. UVA is not unique in this.
Patricia Matthews shares Harris's experience of denied tenure. She wrote a book about it, Written, Unwritten, Diversity and the Hidden Truths of Tenure.
For African American professors on this that go on this tenure track, how much more difficult is it for them than it is for a white candidate?
Well, they're facing a couple of biases going in. They really are getting through on hard work, intelligence, careful planning, resilience, and an ability to make do with a little bit. So that bar is a lot higher to begin with.
Matthew says universities have an opportunity with tenure to prove their obligations to equity and inclusion.
Black faculty have an essential role to play in those visions, and I think it's up to institutional leaders to do the right thing.
That's what this is about for Harris.
This was wrong. This was very wrong. And I think we're going to show some courage and do what's right.
Support is pouring in behind his appeal to the Faculty Senate Grievance Committee. Thousands of Harris's former students, faculty colleagues, and community members are signing on to a letter demanding tenure for Paul. The Center for Race and Public Education in the South tweeted its support in challenge of its own university.
I'm grateful. I'm grateful for every ounce of affirmation and support.
Harris remains hopeful his decade back home on grounds won't end with the memory of marginalization.
That's also why we've come back, to be a part of the change that we know the university can be a leader in, quite honestly, across the country. And that's why we've come back.
Hi. It's Sarah Kay. Hi, Sarah.
These faces
Hello. Hi, Tommy. How are you?
How are you?
light up with excitement
Hey, Naya. Naya.
Hi.
when another tile
Good morning, everybody.
joins the screen.
Hi, Caitlin. Good morning.
Hi, Josh. Good morning. Good to see you. Arms out. Bring one across.
Caitlin Marcotte leads daily activities on the video meeting platform Zoom,
So, here we go.
live from her living room.
You guys know the drill. We're going to do 8 different movements.
On this day, it's an hour of fitness.
See how fast you can go.
Seeing them and being able to, talk to them even over Zoom has been really uplifting.
Marcotte and the City of Charlottesville's Adaptive Recreation Team work with adults who have intellectual and physical disabilities. When the pandemic brought in-person programs to a sudden stop, they wanted to make sure this community didn't get cut off.
Pretty quickly we realized that as recreation professionals that we still need to meet our mission of bringing people together and creating a community and giving them something to do.
From yoga to book club, baking, and rock painting, the Zoom programs provide an escape from the isolation of staying at home and social distancing.
My favorite part is getting to talk to everybody and say hello and just be a part of a group.
The technology is new to Naya Fairchild, but it's allowing her to stay connected with something so familiar.
It's new for me to be a part of that, but I'm glad to get to see some faces that I know from Capernaum.
Naya's mom says her daughter is gaining confidence in adapting to this new normal.
Are you guys doing the show?
She has the opportunity to connect again. And I think it's building community in ways and keeping community in ways that we just need right now.
When Zoom time comes in the Drumheller household,
Oh, he's ecstatic. He's like, okay, it's time for Zoom. Let me go.
17-year-old Zach is ready for the day's activity.
I like to do book club and baking. He does have these connections and that he wouldn't be able to have and have that opportunity to connect with his friends and his peers.
Sometimes these activities get cut a little short to give more time for the on-screen greetings, goodbyes, and gratitude for Marcotte.
You're funny, Kenny. I miss you.
I want to thank you for all you do for this community.
Love can heal.
Through tiles on a screen,
Yay!
these special people form part of the mosaic
My smile.
of a community.
Maybe they have different needs than some people, but right now I think we're all just in need of connection and community and love and support.
In Charlottesville, Matt Talhelm, NBC 29 News.
Bye, guys.